Hello there, everyone, and welcome to Journey to Recovery. Our podcast focuses on the co-occurring disorders of mental health and substance abuse. We present a wide range of thought-provoking, hopeful, and positive topics from a clinical yet practical perspective. Our host is Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. He's the executive director of Northland Counseling Services and the clinical director of North Star Regional Co-occurring Disorder Treatment Programs. He's an author, speaker, and clinician with over 30 years of counseling experience. I'm here today with Tim Bode, Operations Director for Northland Counseling Services, and Dr. Hal Baumchen, Journey to Recovery host and resident expert. Hey, guys.
Hey, Gaylen. Nicely done today.
Thank you.
Thank you for the nice introduction. Our topic today is understanding co-occurring disorders. So get us started here today, Dr. Hal.
Great. So Tim, Gaylen, you know how this works. On Journey to Recovery podcast, we talk about co-occurring disorders. So when you have substance abuse and mental health problems at the same time, then we treat that in a co-occurring disorder program. So we call that a co-occurring disorder. And the field of chemical dependency is actually changing, where people in the field are more ready to acknowledge that when you have a chemical dependency disorder, chances of having a mental health disorder at the same time is about 50%. So I actually think might be a little higher than that, but we're always on guard watching for that. So we're going to talk about how those two things, substance abuse and mental health problems, go together.
I would think it's necessary for every patient and every treatment professional to have a good working knowledge of this emerging field of co-occurring disorders.
Yeah, that's right, Gaylen. And in fact, it's becoming more necessary. So I see that in the equipment training programs that co-occurring disorders is going to be discussed more. And what happens with substance abuse and mental health problems is when you have one, it seems to make the other one worse. So it can come up in the treatment program, and it becomes a big deal.
So that was kind of a definition, right, of co-occurring disorders, where they interact with each other, commonly increased severity of both, right?
Right, yep. So if you have a substance abuse problem and then you become increasingly more depressed, maybe you drink more, then when you drink more, maybe it makes the depression worse.
Yes.
So you want to drink more. Yep. So you're exacerbating both of them with the other one.
Wasn't the term co-occurring disorder actually referred to in the past as dual diagnosis disorder?
Right. And now I think we're moving away from that. Tim, do you remember when we first started a treatment program in Maple Grove, we used that term?
Yes, we did.
Actually heavily. And then we started to see that the field was moving in the language of co-occurring disorders. It kind of means the same thing. With co-occurring disorders, you have the ability to sort of add in more than two. So you have substance abuse, ADHD, some depression, and some anxiety, post-traumatic stress disorder, and a mild brain injury from a head trauma. All of those kind of fit together under co-occurring. When we talked about dual diagnosis, then we were just sort of talking about two.
Right. So it's
I'm sorry. Go ahead, Tim.
so it's a more accurate description.
I think so.
Really.
Yeah. It really helps us understand what's going on with the client.
Yeah.
I know you mentioned this, but again, how common are co-occurring disorders? How often does it come up?
When you're using drugs, then the chances of you having a mental health disorder is about 50%. When you're using alcohol, the chances of you having a co-occurring mental health problem is 37%. So it does vary a little bit.
What do you think? Do you think it seems a little higher than that?
I do, Gaylen.
Okay.
Yeah, I think, see, I work in a skewed environment. I work in an environment where people are referred for co-occurring disorder treatment. So I think most of the patients coming through fit that quite well, but they were referred because of it.
Right.
It's a selective group, but I do think it's higher than that.
Would you say the substance abuse disorder is primary, or is the mental health problem the primary part?
Yeah, good question. Which came first, the chicken or the egg? And I think it can happen either way. You could start drinking, I kind of mentioned this a little bit, and then get anxious or depressed, or you could be anxious and then find that marijuana or alcohol sedate you, calm you down, help you kind of feel good. And so then you start doing that more and more as your anxiety continues. Then you start drinking more, using more marijuana until you're sort of using alcohol habitually. And now you have that co-occurring disorder.
Mm-hmm. So it doesn't necessarily imply that one is caused by the other.
Right. I think we could say, hey, don't you think one makes the other one worse? And I'd be like, yeah, I think so. And maybe even you could start using substances and cause your mental health disorder. We do see that, Tim, with certain drugs seem to trigger severe mental health problems, like launch you into a bipolar manic episode that would have laid dormant. I think we'll talk about that later as well.
So what I'm hearing is neither one is really considered primary. And I guess we've already kind of talked about this a little bit as to which one comes first. I vote for the chicken.
Yeah, right. I vote for the egg. Yeah. Can't be a chicken without the egg. Can't be an egg without the chicken.
Yeah, it's a conundrum.
It's another good question, which one of these is first. But again, I think you could start with either one, and then the other one can creep in and become worse over time. After heavy drinking, often a person will experience anxiety or depression or relational problems or stress, worry, grief, all kinds of things start coming up because of the drinking or drug use. Then, those mental health problems get worse. Using drugs can even launch that bipolar illness, like I mentioned earlier.
Yep, so either one way or the other. It could happen either one way or the other.
Yeah, I'm sure it does. I can't say which one is the most frequent. Maybe there's statistics on that, but I actually don't know that. Someone with anxiety, depression, post-traumatic stress disorder may self-medicate. That's a term in the field when we're talking about co-occurring disorders. Hey, I got that mental health problem, and I began to self-medicate the symptoms of the mental health illness. So using, again, alcohol for anxiety or a stimulant for depression.
I can see where some of the symptoms of a mental health disorder would definitely push someone to look for some form of escape.
Yeah, I'm sick of this, and I don't like feeling like this. And then when I'm high or drunk, I don't feel it. So, yeah, that's pretty enticing, pretty tempting to go back to that. In one weird way, please don't hear this out of context. In one weird way, it works, but only for a very short time, and then it comes with penalties and interest. Kicks you in the butt, bites you in the pants, won't let go.
Can you give us an example of what this probably looks like, what you see in real life?
I brought a case that we're going to talk through, and just to give him a name, I called him Jackson. He's a 45-year-old single guy with 2 daughters, and he doesn't have contact with his daughters anymore. And I met Jackson in a treatment program where he was referred by a local hospital where he had been detoxed.
Well, now, why would he need detox? Why not just go right into treatment?
He's drinking, we'll get into this, so much that if he stopped drinking without medical care, he could have a seizure, he could even die. So he had to go to the hospital for detox, but then he had such high anxiety, I think they started treating him with some psychotropic medications to help manage the depression and anxiety that he had as well.
What was he like when you met him? Was he upset?
He was so nice. It's like sitting in this room, and he doesn't look like an alcoholic, and he doesn't look like he's drinking as heavily as he is, and he doesn't look like he was homeless or wasted his life, but in fact, he had a lot of things going on. My point being, he just didn't look like that, like some homeless person in a homeless shelter or on the street in a big city. It didn't look like that.
Yeah, so is that common, that outward appearance doesn't look like they really need treatment?
Right, it's true, isn't it? There's more going on for most people than we would guess. What's your story? What's your story, Hal? So yeah, there's always something going on, it seems like.
What was going on with him?
Well, like I mentioned, he had this history of anxiety, and that started when he was really young. It had to do with physical symptoms of anxiety when he was in public. He would feel uncomfortable, he would blush, he'd feel sweaty all over, his heart rate would become rapid, and then he'd get dizzy or lightheaded, and he had trouble concentrating and focusing. And when those symptoms would occur, he would become increasingly more uncomfortable. So he got these panic attacks. And then once you have a panic attack, I bet you can guess what happens. You start worrying about having another panic attack. What if I had a panic attack in the middle of a crowded theater? What if I had one in the car? What if I had one on the way to an interview or something? So he started to avoid things that made him uncomfortable.
Is that common in people with anxiety, Dr. Hal?
Right. Once somebody has a panic attack, they begin worrying about having those feelings again. What if I have a panic attack when I'm talking to you guys on the radio or on video and have a panic attack? So then that person begins to avoid the things that he thinks might make him anxious or panicky.
It just seems like the misery gets worse with anxiety and is self-perpetuating.
Right. You would think, okay, I avoided this one thing one time, but avoidance is a funny thing. It never is satisfied with avoiding one thing one time. It's going to want you to avoid more and more. So it is self-perpetuating. And then when he starts drinking to calm down, then that calms his anxiety for a moment, but then he wants to drink again when he gets anxious again.
And that was what was happening with Jackson.
Right. Getting more and more addicted to the alcohol.
Yeah.
I'm sure that just drives the need then to use alcohol whenever you feel that upset or anxiety coming on.
Right. And Gaylen, then once you start that, I wonder if you're more sensitive to things that make you anxious. So tiny little things make you anxious or upset or panicky. And then you drink more, which causes more trouble. Then you drink more because you're in more trouble and you're more anxious. And you have this perpetuating cycle going.
Yep.
What do you know about Jackson's background, Dr. Hal?
The client started drinking when he was 12 or 13 years old. And at first, he was a functional alcoholic, meaning he could go to work and come home and he'd start drinking. He would manage to go to work most days. Sometimes he would leave work early to start drinking. And when he got home, he'd start drinking beer.
I'll bet he drank a lot, or we wouldn't be talking about it.
Right. He drank 6 or 12 beers a day for many years. And then right before treatment, he was drinking 16 to 20 beers a day.
Wow.
He started, he told me that he did this every day. He'd come home from work, sit in a chair, start drinking beer, watch TV or something, and then end up passing out and sleeping in the chair. Then he'd wake up in time to get ready, go to work, do it again.
Wow. Just an unbelievable amount, isn't it? No wonder he needed detox.
Right.
Wow. Again, as you said before, if you quit using subs suddenly, you'd have a seizure or even die.
He could die from that, yeah. So when you come across somebody, we just had a client like this in the mental health program who wanted to quit drinking, and we told her to go to a detox center to do it because she was drinking a couple of bottles of wine per day, and we feared that if she just quit, and she had the resolve to do so, but we feared that if she did, without being under medical care, you could start having a seizure. Somebody wouldn't know what that was, or nobody'd be around. It'd be real dangerous.
Well, Jackson certainly has a substance use disorder, doesn't he?
He fits the criteria for that co-occurring disorder. He's got a substance abuse problem. He's got an anxiety problem. He had times in his life where he tried to cut down on alcohol and found that he couldn't. He continued to have strong cravings for alcohol. These are a couple of signs of having a substance abuse disorder, an alcohol use disorder. He'd spend most of his time thinking about alcohol or where he was going to buy it or when he was going to drink it or how he was going to leave work early to go get something. On Sunday, what are you going to do? You're going to run out. And back in the day when you couldn't buy alcohol on Sundays in our state. And so he'd spend time drinking or buying or thinking about it or recovering from it.
So not only did he consume alcohol, but alcohol really consumed his life.
Yeah, I like thinking about that, Gaylen. Like, at first, you're in control of it. You make the decision, but pretty soon, alcohol's calling the shots, or literally pouring the shots, I guess.
So what was the impact on him meeting his obligations, relationships?
It all falls apart for him. Jackson needed more to drink and to get the same effect. As time goes on, his tolerance for alcohol goes up, so he needs more. And keep in mind that he was using alcohol in part to manage his symptoms of anxiety. So there's this co-occurring disorder of alcohol use or substance use and anxiety.
What did you mean when you said he used alcohol in part to manage his anxiety?
What's happening here is you have this much anxiety and you need this much alcohol, and pretty soon that isn't enough. So what he did was he found a doctor who gave him an anti-anxiety medication like Ativan or Xanax, and he started to use that. That worked pretty good. So pretty soon he's getting a prescription monthly for something like that, an anti-anxiety medication, but he burns through the month prescription in a week or two, and now he needs even more of that too. Plus he's drinking more. He ended up using anti-anxiety medications along with alcohol for 10 or 12 years. He'd use up that 30-day prescription, like I said, within a week or two. And then in order to minimize the withdrawal effects, he'd have to find a way to get more meds, like buy them on the street or drink more alcohol. So really had some drug and alcohol and mental health problems going.
No question, he was having a co-occurring disorder, alcohol use and anxiety.
Right, and then add in the prescription med abuse as well, sure.
Yes, sounds like things are really getting worse for him, aren't they?
Getting out of control, I think. He was drinking more and using more prescription meds. He'd use 6 or 8 milligrams of Ativan a day and then drink all those beers. Yep, just really starting to lose everything, lost relationships, lost his job, lost his house.
Well, I'm sure that adds to his sense of loss, depression, guilt, other things.
Right. He bummed around, Gaylen, lived in a rental house, just kind of a gathering where drunks live, and somebody comes up with a little bit of money. So really his life's fallen apart. He told me that he had a lot of regret, a lot of remorse. He felt guilty about how he was living his life and how his daughters were being treated. He had ruined relationships. And he told me that alcohol runs his life, which I'm sure was true. And he told me, I've lost everything. I've burned all the bridges, and I've hurt everyone that I know.
So we're discussing the case of Jackson, a man with anxiety disorder and substance abuse problems. Dr. Hal, how did he finally get some help?
He went to the ER having a panic attack, thought maybe he was having heart failure or something, and I'm sure with all that heavy drinking, he realized his health probably wasn't good. He went to the ER, got hospitalized. They helped him identify some of the problems he was having with prescription medication, with anxiety, and with the drinking. And so they referred him to a residential treatment program. That's where I met him. And after 20 years of serious alcohol use, that was his first treatment.
Wow. So let's take this back to talking about co-occurring disorders. What makes Jackson's case a co-occurring disorder problem?
Not surprisingly, it fits all the criteria, doesn't it? He's got that anxiety disorder. He's got some avoidance patterns. He's got panic attacks. He's drinking heavily. He's craving drugs. He's using more. His tolerance is going up. So, yep, he fits criteria for a co-occurring disorder. And then what you want to do is treat that. We're going to talk more about treatment later, but you want to treat both of those at the same time.
Can you talk a little bit more about the anxiety part of his case?
He's got worry, ruminations that interrupt his normal thought, worrisome thoughts that intrude into his mind, those kind of obsessions, and you should quit drinking if he's worried that much. But no, you can't quit drinking and he can't stop worrying. So those thoughts that just repeat in your mind over and over again. And then the panic symptoms like the rapid heartbeat, shallow breathing, sweaty all over, shaky, that sort of thing.
So anxiety is a big part of his problem, isn't it?
Absolutely, yeah. You can't separate them. Like, well, just quit your drinking, you won't be anxious. No, he's drinking because he's anxious. Well, quit your anxiety, quit worrying so much, and then you won't have to drink. But, I mean, he's so far along into this, he can't stop either of those without help.
And has it been a lifelong thing for him?
I think so. He started drinking when he was young, but he started being anxious even younger than that. Mm-hmm. So, yeah. Mm-hmm.
So he's got a lot going on. One of the things that I kind of want to follow up on is sleep problems. Can you talk a little bit about sleep problems and sleep disturbance?
Yeah, so he had this fear and anxiety since he was very young. I think in the 4th grade, he had some illness anxiety, and then he had some sleep problems where alcohol can sedate you at first. And so he was using alcohol to try to get to sleep, but alcohol can really mess up your sleep too. It may sedate you at first and then even help you feel drowsy and fall asleep, but then it wakes you up in the middle of the night, you become more restless and your sleep is interrupted and disturbed, and you don't get the quality of sleep that you would. And I don't mean just get up and use the bathroom because you drank too much, although that's probably in there, but just interrupting the quality of your sleep.
I'm sure anxiety as well will interrupt your sleep.
Right. And my little rule of thumb is if you have anxiety, you have trouble falling asleep because your mind won't shut off. And if you have depression, it often wakes you up in the middle of the night. Substance abuse will do that too. So, yeah, he had the anxiety sleep problems and the alcohol sleep problems.
Mm-hmm. So where do you start in treatment with a client like Jackson?
Well, he started in detox, and I think that was appropriate, of course, and then the hospital stay, kind of see where things are at, do some preliminary diagnosing. And then he went to a residential co-occurring disorder treatment program where we treated the anxiety and the substance abuse at the same time in the same place with the same treatment staff. Then he went to an intensive outpatient for, I think, about 3 or 4 months. And that was, food and lodging provided along with treatment, but he can leave the facility. And then he stayed about 6 more months in sober housing. So he had a good year of treatment, which really helped him.
So I think looking at our time, we better wrap this up and come back to this in our next podcast.
All right.
Thanks for listening to today's podcast on the treatment of co-occurring disorders. You can download materials that help you develop skills to identify emotional problems, reduce symptoms, and prevent relapse at journeytorecovery.com. We've been visiting with Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. His expertise and clinical wisdom is now available at journeytorecovery.com. Share this resource with your peers and colleagues. See you next time, and remember, recovery is a journey. Enjoy the ride.